Dr. Ahmed, good to see you again.
Hey Harrison, so good to see you. Where are you?
I'm in New York. How about you?
I'm in London, so good to see you. I think we've got Ian here as well, haven't we? Hi Ian.
Hey guys, I'm in downtown Atlanta right now. Thanks for joining me. I forgot my Magic Leap, but I've got my phone handy, so joining you through here.
Thanks for joining us. Anyway, Harrison, how can I help you?
Yeah, you know what? Obviously, coronavirus is top of mind at the moment, and I wanted to find out from you if you could explain a little bit about what type of symptoms to be looking out for, and should I be experiencing it, how to go about managing it.
That's a great question, of course, Harrison. It's obviously on everyone's mind at the moment around the world with lots of infection that we're seeing. So the first thing to say, it's a bit like flu. So you get symptoms of a dry cough, you may feel a bit nauseous, you may have a fever, you may get some muscle pain that you often get with the flu. It's those kind of things that we worry about. More importantly, it's about if you've had contact with people with flu or coming or travelling from the area that might have had some infection recently. So those are the things that kind of we ask for our patients. Once we ascertain that fact, if you're at risk, we suggest that you undergo what's called self-isolation. Stay away 14 days so that you reduce the chance of infecting other people. Making sure if you sneeze, for example, you sneeze with a handkerchief, that you wash your hands regularly but thoroughly for 30 seconds, and take every precaution to avoid that contact that might contaminate others, for example. And that's the advice we give. If it's a bit more severe, we sometimes get difficulty in breathing, which means that might be more serious, for example. So those kind of things, I hope it helps you.
Yeah, no, absolutely. I appreciate that very much, Dr. Ahmed. From a greater perspective, I mean, how are things going right now with containing the case?
Should we have a look at some images to help us in this regard? Let's try. I'm just going to pull up an image of the virus itself, just to show what it looks like. So if you look at this, we can actually walk around. So I'll show you as we walk around together. You'll see that this virus here at the moment is, it's quite infective. It's got this S protein on the surface here, which can penetrate human cell membrane by going through what's called the angiotensin converting enzyme pathway, hence infecting human beings. So that's what it looks like in terms of the structure. Should we pull out a few images now to show the effects around the world? So let me just pull up this image here, which is showing the kind of the incidence around the world. And these are confirmed cases. So what you see in this graph, Harrison, is essentially countries across here. These are China, Iran, Italy, and South Korea, as well as showing you the infections and confirmed cases are on this side here over the course of time, over days, for example. What you're seeing is in China, parts of China, it's become quite static at the moment in terms of numbers, with no huge increases. But what you see in Iran and Italy, in South Korea, are those huge peaks, which I'll demonstrate to you.
Right.
Absolutely, around there. And you see these huge peaks. What it's showing you is a graphical representation of what's going on around the world at the moment. And let's take another picture out and show you the camera cases. So again, this is a similar kind of graphic representation, but it's showing you how people are recovering now, getting better from the virus itself. Again, you see China, huge amounts of people recovering. We've seen now, obviously, with incidents in Italy and Iran, you're seeing some people now recovering from the infection. And obviously you're seeing the graphical representation around the world, and we can extrapolate it to other parts of the course. Of course, let's show you just one more graph. Okay, sadly, this is obviously the most worrying part of it, and these are the deaths at Harrison. Sadly, there is a higher incidence of death rate compared to normal flu with the coronavirus. And we're seeing, again, how the deaths in China are being managed and have come to a kind of plateau. We're seeing huge peaks through Iran and South Korea now, where the infection is becoming more common. It is, indeed, you can see the slight peaks. And as the course of time, we'll see more and more countries go through a similar phase of getting infected, having complications and perhaps deaths as we recover from this terrible illness. So I hope that was helpful to you, Harrison, to explain where we are currently.
Absolutely.
Well, hey, thanks, guys.
So
Appreciate
guys,
that very much,
thanks
Dr.
very much
Ahmed.
for joining us. Thanks for joining us from various parts of the world, from Atlanta, from New York. And this is the kind of future of teleconsultation, seeing patients, particularly with coronavirus, where contact is obviously much more difficult with people. And we've got to think differently about going to conferences. We've seen recently a lot of conferences have been cancelled, and perhaps this is the way in the future we can go to conferences, see our patients, discuss and share knowledge. And it's an amazing platform that you guys have created. So thanks for sharing with me.
Thank you,
Absolutely. Thank you
Shafi.
very much.
Anytime. Talk to you later.
Bye, Dr. Ahmed. Bye.
Bye, guys.